Good afternoon, everyone. You're all welcome to yet another episode of Expert Mind with Dr. Zainab. And on today's episode, we'll be talking about a growing global health concern, which is the antimicrobial resistance, which threatens the effective prevention and treatment of infection caused by bacteria, fungi, virus, and parasites because there is misuse and overuse of drugs. Where these antibiotics are misused and misled by farmers, poultry owners, and livestock. So that is why today we are having three experts' minds with us today. They'll be introducing themselves. Let me start by my left.
Good afternoon, everyone. I'm Dr. Toby Onyeonda.
And
Hello, everyone. My name is Dr. Eja Victor.
Hello everyone, my name is Dr. Deborah Oladeji.
okay, so today we're going to look at antimicrobial resistance in abattoir, in livestock management, and of course in poultry egg production, because we have these residues of antibiotic within the meat, and of course you can also find it within egg, the residues within egg. So I'm going to start asking Dr. Toby, so what is the role of abattoir workers in the transmission of antimicrobial resistance bacteria? Can you shed more light on that, please?
The role of abattoir workers in AMR transmission. Now, you know that the abattoir workers, they work in the abattoir and they come in contact with the meat, they come in contact with the ruminal content, and all sorts that pertains to the meat. So they serve as vectors for moving of these bacteria from the carcass to the abattoir environment, humans in the environment, and also to the community at large. Whenever they go home, they go to hug their wives, play with their children. That way, it spreads, and then the AMR bacteria is out there killing and
Causing harm. So thank you, Dr. Toby. Okay, before we dive in, I would like to ask Dr. Victor to, in a layman understanding,
Okay.
can you just define antimicrobial resistance?
Okay. For a layman, it is important to understand that antimicrobial resistance isn't just, a big word. It's just basically indiscriminate use of these antimicrobials, like the non-common antibiotics you can find over the counter and in normal pharmaceuticals. And then you just buy them and you use them without prescription, or even for your own self, you're doing self-medication. With time, these antibiotics and antimicrobials, whichever one they are, they tend to, accumulate in your body. And then, of course, over time, the bacteria that they are supposed to be fighting against now develop some form of resistance, such that even when you give these antimicrobials, they're no longer as effective, because sometimes you give them indiscriminately without prescription, and sometimes you yourself tend to want to become the doctor.
Exactly.
You see,
because people misuse.
yes, because you can easily get these drugs over the counter. You could just go and say, give me Panadol, give me amoxicillin, give me, and
Yes.
then you just buy it, and you
Just
go
buy
home
it.
and you tend to want to become the doctor in this case.
Yes, because people don't usually reach out to doctors,
Yes,
to their
exactly.
vets, to even the medical personnel if they get sick.
Yes.
So instead of consulting their doctors, they just go in. Okay, this is. They will even diagnose
having
themselves.
headache.
Yes.
I'm having headache.
Okay,
Paracetamol,
I
just
need
take.
antibiotics. So
Exactly.
before you know it, they will now become resistant to it.
Yes.
So can you tell us how this antimicrobial resistance is affecting the health and welfare of livestock?
Well, in livestock studies or in livestock farming, so to say, it is of great importance because, when this develops, right, we as humans, even within the livestock themselves, transmission and all that, because one, of course, if you notice, say, the simplest bacterial illness with a said cattle, without proper tests and diagnosis, You could just go and say, okay, this might be what is wrong. I've seen the doctor give this, and then you buy and you give the cattle. Over time, they develop resistance. And the very funny or tricky thing about it is, with that the resistance they develop, sometimes you could push these animals. There's something called withdrawal period. Withdrawal period, just not to overextend it, is just basically when you give a particular drug, there's amount of time you're supposed to live before you're able to consume this meat to the public. You're able to take this meat to the public for consumption. But sometimes you could just jab antibiotics today. Tomorrow, the meat is out there for sale, and people taking this meat without even knowing. You might not even be sick. You're taking in supposed antibiotics that is inside the cattle meat.
The cattle meat.
And over time, you develop resistance even without knowing. So it is great. It's of great importance that these measures are put in place to curb some of these things amongst the farmers. But what is more important is that within the farmers' ecosystem, most farmers at least lack the basic knowledge of medicine, so to say, or even public health awareness to guide them in some of these practices. Because they tend to want to, okay, as a vet, they call you, what did this vet give? They are watching, they are saying, okay, today he gave this one, write it down. Tomorrow you can buy. How many pills did he give? You want to give to. And then you do not observe some of these key factors that are being looked into or that are in place. And then even within the doctor's sphere, sometimes appropriate test is not even taken before drugs are being administered. You could just give, okay, these are common signs, these are common illnesses we see. And sometimes certain diseases could present with the same clinical signs. And you're giving maybe general antibiotics that should curb this particular illness. But over time, because maybe that is not what it is there to treat, certain antibiotics, over time, the bacteria start developing resistance in that cattle. And then, of course, this cattle go into consumption. And sometimes it could even be transferred to their offspring.
Exactly.
Yes.
So thank you for shedding more light on that.
Thank you.
So back to you, Dr. Deborah. How can antimicrobial resistance lead to the contamination of eggs with resistance bacteria?
Thank you, Dr. Zainab. If I understand your question, how can AMR
Yes.
lead to contamination of eggs
Yes.
in poultry?
Yes, because I had you can also find residues of this antibiotic
In eggs.
in egg.
Okay, so just like my colleagues here have said, let's first start from the human pathway. The human pathway from human beings. In every farm, there are human beings working on that farm. No matter what you do, there are people working on that farm. There are workers, there are visitors, and those people, because of poor use, misuse, overuse, whatever type of use, they have created this phenomenon. They've created bacteria that are resistant to these drugs, and they will come to that farm. They will touch things in the farm. They will touch equipment. They will touch, and that would affect the eggs when they're packing, when they're processing. That is one pathway in which eggs can be contaminated. The second pathway that is most important in poultry is usually through the eggs, like the chicken themselves, the poultry themselves. Usually when they have diseases like E. coli,
Colibacillosis.
sorry about it. Farmers usually use antibiotics, and they would overuse it. They will overuse it most times, especially since most of them do not call veterinarians. That's a very, very important part. Most farmers, especially in Nigeria, do not call veterinarians. And then there's this farmer around here, use this antibiotics, let me use it. He used this antiviral drug, let me use it. And that would cause the bacteria to be passed out through the digestive system. It's going to be through their guts. And where does the egg pass? Because
Exactly.
it's around that area, so it's the same place that's coming out through. So as the egg is coming out, it's coming out with AMR, and the eggs are gone. One more pathway is usually from, I think those are the major parts. Those are the major parts from the chicken and from human beings. And also chickens affecting chickens.
Within the farm.
yeah, in the farm. So, thank you.
All right. Thank you, Dr. Deborah. So back to you, Dr. Toby. Can antimicrobial resistance bacteria usually contaminate meat products during slaughtering and processing?
Thank you once again. Um, yes, they do. When the carcass or when the meat that is meant to be consumed comes in contact with, say, the ruminal content, say, the feces of an animal that has these bacteria or these microbes, AMR microbes in. So once those microbes come in contact with the meat becomes contaminated, and then hence strict biosecurity measures, hygiene, and use of PPE is always advocated for workers in the abattoir to prevent this, because you won't even know the animal that is having most of this. And then once it comes in contact with the meat from the abattoir, the meat is going to the market. You don't know who is buying. You don't know how she's going to process it. We don't even know where the meat is going.
Exactly.
Surely it's going to get consumed and then infecting that person, or we in the abattoirs are infecting the person.
And maybe right from the larynx too.
Exactly. Even
When
from the lineage,
instead
direct
of them,
contact with
yes,
the
using the
animal.
withdrawal period to monitor that, they just slaughter it.
Yes.
From there, it's another.
Yes, I agree with you. Please, I agree with you. But that is another aspect, because ideally in the abattoir we want to test for this AMR and
Exactly.
even test for antibiotic residues in these animals.
Yes.
So yes, so once an animal that has these residues is being slaughtered, and then the residues is still in the meat goes to the market. Whoever
And then
consumes
bias
it
now,
eats,
yes.
and then continuous use or continuous consumption of such would make those microbes build resistance towards, because they've been previously exposed.
Yes, to that.
Is a survival mechanism. They will just want to try. Everybody has to try.
And then now, what happens to, like, let's say, when a pregnant woman consumes that? It's another pathway.
I think that's the only
Because yes, because I had an issue like that with a neighbor. I think her baby is already having resistance to antibiotic, and the baby is just barely a year. So it's basically because she said she used to give the baby meat. Sometimes you even find egg, sorry. So I was thinking that it's just that egg that maybe the baby consume, or maybe is it the milk she used to feed her with?
Okay. You want me to answer that?
Yes.
Okay. Yeah, as we all said, these residues, we don't follow, as my colleague said, he said, we don't follow withdrawal periods in this country. So these antibiotics or antimicrobial residues can be found in meat, in eggs, in milk most especially. Given that she's a nursing mother and she will also need milk replacers, milk replacers or fresh milk, I suppose. So one way or the other, the baby must have contacted
Consumed through the years.
exactly, or yes, baby must have contacted the bacteria from the environment, from the mother, from the father. They go out, take something, you don't know what they come in contact with, and then also from the food, the meat, antibiotic residue buildup, the normal flora in the body and the pathogenic one gets exposed to that and then tend to build resistance to survive. So that's how.
Okay.
Can you chip in?
Yes,
Dr. Victor?
something just came to mind while you was talking.
Okay.
I'm looking at, say, when we say antimicrobial resistant, we're not talking about microbes or bacteria that are particularly abstract. We're talking about our day-to-day stuff. You understand? And stuff is ubiquitous, so to say. They are everywhere. You can find them. I'm looking at a scenario where you want to, maybe during parturition, right? When the mother is giving birth to the said baby in a hospital, that maybe the procedure was not handled correctly. Like I said, these bacteria are everywhere. You could find them even in the equipment used inside the labor room where they are giving birth, and then this child could even get contaminated from them. And even normal trans mammary say, okay, while they are suckling, they get infected because these are also present. That I think there are some medications that you shouldn't take as a nursing mother and all of that because these are very small. They could poke into different holes and all that. But like that is also a particular angle I'm trying to look at it from. Even the instruments and all that's used, because these bacteria, they are not abstract. They are just different strains of the common bacteria we know. Because they've mutated, they've gained some form of superiority over normal antibiotics we use. Over time, they just grow, and then you can find them just about anywhere. We have stuff here on our skin.
Yeah.
Even contact with it, unprotected, you could get infected and all that. If it is one that has the resistant bacteria, if it is one that is now resistant to the antimicrobials, you already have that. And over time, they build this immunity and strength. Basically, they are trying to survive, just like my colleague mentioned. So they are trying to say, okay, this thing is killing us. Let us form our own army against these things. And then over time, if one of them, I'm trying to look at it from a layman's perspective. Say you now, you've gone and you've seen that, okay, if I hold this shield up against this particular antimicrobial that is coming towards me, it will protect me. The other one is looking. They are more definitive way to explain this. I'm just trying to look at it from a layman's perspective. So he's now looking, the other bacteria is saying, okay, this one is holding this, so it's covering him. Tomorrow, me too, I will hold. And then before you know it, it has spread. And then all of them, they've formed different strategies to fight against these antimicrobials. You're supposedly using to fight them all. And then they've used it now as a protective mechanism for themselves. So when you even give it next time, it's like, oh, this.
Oh, yes. What is there?
You understand what's there? There's nothing new. Just bring it on.
So
now you have to
start.
start. Yes, exactly. So these mutations now are what usually leads to this resistance we are talking about.
Yeah.
So I'm just trying to pinpoint the fact that these microbes we're talking about are not particularly new microbes. They're just the ones that are normal, that we see day to day, that cause different infections. Just over time, they've mutated and then they formed resistance.
Exactly.
Yes, so.
Thank you so much for shedding more light on that.
Thank you.
So, Phil, I would like to ask, what are the risks of foodborne illnesses associated with meat from animals with antimicrobial resistance?
Okay. When we say foodborne, we are basically talking about what we ingest, right?
Yes.
And if the meat of these said animals are infected, right? You as even let's say somebody let's even look at it more practically, right? We have antimicrobial resistance present in this meat that we consume because of a variety of reasons, where they've been transmitted and all that. Okay, so now, you that is supposedly an immunocompromised person, you ingest this meat, it goes into your body. Maybe, how all of these things work. I want to look at it as though maybe it has gone into your system, and then it has sensitized other bacteria there that, this is the new way to, fighting. Yes, I'm trying to look at it from a layman's perspective. You understand?
Yes.
It sensitized other bacteria, this is the new way. So now this person that is immunocompromised, you'd see that even within their system, right, they now have, there's now a tilt between these microbes that are now resistant against our normal antibodies that are supposed to be fighting them. And if you're already immunocompromised, this could weigh you down even further. These are also risk factors I'm just trying to say, from a layman's perspective, it is very important that what you eat, what you ingest, what you take in, the food, even the food sources, even aside meat itself, vegetables in the market, at least most often here in Nigeria, we practice our beans, they're just there. And if you go and you don't wash properly and all that, even our egusi, it is just there. You just measure. The same cup that they used to measure for Obi, they used to measure for Peter. And over time, you would see that you might go home, you just grind, and then you go home and boil. Okay, what about the ones that are lay-by? that they could withstand heat. Yeah, they could withstand a lot of heat,
Exactly.
and then they are there, and then you ingest. The process just goes on and on. So the importance of this antimicrobial resistance cannot even be overstated, and it cannot even be covered within such a short period of time. It's something that has to be looked into, because down to everything, right? Because from the humans to the animals, from the animals to the humans, and this is something we cannot do without. You have to eat meat. I have to grow muscles. So these are all things that, yes, we could relate to.
Yes.
Yes, and the environment,
Yes.
of course.
Yes. So thank you so much. So back to you, Dr. Deborah. So how can consumers be made aware of these risks of antimicrobial resistance and the importance of proper food handling and cooking practices to prevent foodborne illnesses from egg?
Okay, thank you, Dr. Zainab. Before I dive into that, I think I would like to pitch in on what they've been saying. I think it's very, very important that everyone understand that most of these bacteria causing diseases are actually normal bacteria organisms that are in every part of the body. If it is not normal in human beings, it's normal in a baboon. If
Yes.
it's not normal in a baboon, it's normal in a chick. It varies. So it's when it is in the wrong system and it's over your immune system is like, I can't fight this anymore. I think once we understand that concept, it will make us understand how the bacteria is not like, okay, they are organisms. One of our major reason why we are organisms that want to live. So organisms too want to thrive, they want to live, they want to blossom. So it's not like they are angry with you. They just want to live.
Yes, they want to survive.
They just want to survive. So
Yes.
they are learning just the same way we are learning. They learn, they pick up skills, they pick up ideas,
Information yes.
from your body. So now imagine that normally your body has these bacteria normally, and these things can even cause problem. You are now adding extra by putting
in resistance.
Like resistance. You are giving it more energy. That's where the issue is. But okay, moving on to how to educate the masses, how to educate. I think first of all we can even say that this event we are doing right now
Yes.
is one major step. It's one major milestone that we should appreciate. That is education, and telling the public as much as possible this is a problem. Before we started, we were discussing how babies are getting this resistance as they are born. It's not even like they've given birth to you, finish, and you now acquired it. No, it's like as you are born, you have it. You came to the world and you have it in your body already. So it's like you don't even have a choice. You can't even say that I'm not eating egg or I'm not eating meat. So we really need to educate the masses as much as possible. Veterinarians out there we should integrate with organizations, health organizations, to tell the public about all these things. Then further ways is research. Usually, I think it's very, very important to know that to create an antibiotic, it takes 10 to 20 years. I don't think most people know about how hard it is to get these antibiotics. They just think, oh, amoxicillin, oh, I can easily get it now. Some people have worked very, very, very hard to get these antibiotics out there, to get it, to be able to cure your diseases. So if you know that research is hard, it will help you to prevent stuff like that. So research is also a way to help curb these things one way or the other. Research on why people are doing this, and it's from research you can know where the problem is coming from. You know that okay, these people in this area are doing this, these people in this area are not doing this, and then practicing veterinarian code. Like whenever you want to treat an animal, always call a vet. We always like how we treat ourselves as human being in Nigeria or in Africa. We tend to do that with animals. Instead of calling or going to the vet, I have a headache. I don't like that thing. I have a headache. First thing I'm doing is to get paracetamol. It is not. You're not supposed to do that. Look for other means to prevent that. First of all, eat, because for me,
sometimes it's even stress.
It's just sleep. So if you first do those three things, then if it should be the last resort. And even if after so you should go to the hospital. So that's how people will say, oh, I have typhoid. How do you know you have typhoid? So that is how you should also treat animals. Don't just assume because your neighbor said it works for them. It doesn't mean it will work for you.
True.
That's true. Thank you, Dr. Deborah. So back to you, Dr. Toby. How can we minimize these risks?
Okay, minimizing
These
AMR.
risks, yes, antimicrobial resistance.
So first off, um, enacting and following strict security measures, strict sanitation, strict hygiene, and then public enlightenment will do. So, in order for us to manage this, because as my friend rightly said, he listed out the risks and then she buttressed. So what we just do is how to manage this. We follow as I said, the biosecurity measures, strict biosecurity measures, strict sanitation, hygiene protocols, and for those in the abattoir, they should always use their PPEs. PPEs is very,
Yes,
very,
most of
very,
them
very
don't usually
important.
use that.
If you should look at the status quo of our abattoirs today, anybody can just go in with anything and come out.
And
with
they are
Instead,
actually
they
in
should
high
all have-
risk.
Exactly. Instead, we should all have they are not even protecting themselves. Instead, I guess they are all contributing to our problems.
That's
manage-
true.
Yes.
All right, thank you. So, Dr. Victor, how can biosecurity measures be implemented to prevent the introduction and spread of resistant bacteria in
Okay.
livestock operation?
Okay, I think for that, I would want to look at three aspects. One is usually, or rather the simpler one, management and animal husbandry. The second one is the people going in and out of the said livestock farm. And then the third is the livestock themselves. Management here would fall under, appropriate and what do I call it now? Healthy way of managing these animals. Feed them when you should, take away the feed, clean the places where they sleep, and make sure and ensure that adequate care is taken. For each, like when I mean each, I mean for each livestock in your farm, you have to be concerned as to observe and look at them, say something is wrong somewhere, isolate, watch, and say what am I seeing, what is it leading to, run proper tests. I think that's something I wanted to add. Diagnosis is very, very important.
Very.
Test. Say I'm down with headache, what could be wrong? Collect samples. Oh, this animal is pooing watery poo, what could be wrong? You take samples from there and try to pinpoint what is wrong. So when you're treating, you're being very specific,
Exactly.
and it is very direct to that. So that is for management practices, with or without, additional education. Just you within your farm, try to keep it as clean as possible. Sanitation, isolation of these animals. So that takes me to the next one. People that are coming to the farm, understand? Just like we are mentioning PPEs. If it is possible to say you can restrain or refrain or reduce the number of people coming into your livestock farms, please do that. If you cannot, then maybe most times, right, for like maybe poultry farm, they would say a unidirectional flow. The way you come in is not the way you should leave and all that, so that you don't take in something and bring it back in and all that. And then there are those, foot dips they set on the entrances to most of these places, so that you don't take in something into these farms. So that is one way. If you can reduce access to your farms, reduce, or even if it is possible to completely eradicate, so that whoever is coming in, even though it's not possible, but whoever is coming in should be somewhere that is vetted. Like we know that this person is okay. You understand? Different. No, I'm not even talking about.
Farms will have that.
No, like even if there's a way.
Visitors is allowed.
Yes, ahead. You understand? No visitors allowed. Even if you're going to be allowed, there are certain measures that we put in place so that we curb some of these things, some of this transmission. Even if you're coming for, say, sightseeing or whatever, you can just be placed in a place. You understand? You'll be sightseeing from afar. Yes, there's that. And then within the population, first you should know that whatever you're keeping into your farm, should be the establishment should be such that the number of animals there are adequate, they are properly cared for. You don't just keep farm animals for the sake of it. You pack like 100 animals and put inside a room that will contain at least 10 or 15. You understand? So that is something of great importance that should actually be looked into. And then the exposure, their drinking waters, their where they eat, where they poo and all that. So I think that is something that we should, yes. For these farm animals, I like to think that, isolation, just like I mentioned when I was talking about the management. Once you see that a particular one is sick, you isolate and find out if it's even a very infectious one that maybe would have contaminated the rest. And these ones that are sick or that have been exposed to these sick ones can also be isolated. You take in all those, I can't remember the name right now, but like there are certain measures you can put in place so that these ones are the sick ones, these ones are the ones that have been exposed to these sick ones, and then the healthy
Isolate
ones.
them.
All of this, there are different parameters that could be put in place so that
Yeah.
adequate care is taken so that the sick ones do not infect the healthy ones. And then, even for, I don't know, the feeding troubles and all that, you
Yes.
understand? Maybe if it is possible, that's okay. Cat one, this is your throw.
Yeah.
You don't try to mix it because I would like to think that is also a way,
Yes.
for this diseases to be transmitted. I know this is some of the things I'm saying might not be easily obtainable, but it's something that in your own sincere and honest way you could try to practice and take adequate care. Sanitation of very high importance.
Environment.
This isolation, when you say this is animal, move it away from the rest so that you can be able to isolate and properly watch, okay, what could be wrong? Do the appropriate tests. The ones that have been exposed to these ones, isolate them to the healthy ones, take care to not get them infected. If it's possible, maybe even have different, what's it called? What do I call them? Laborers attend to
Exactly.
each one so that this transmission. And then, of course, whichever laborer is going in there should be under PPE and all that. So these are some of the very simple ways you could try. Thank you
All
very
right.
much.
Thank you so much. So, Dr. Deborah, what alternative approach to disease prevention and control can be used on antimicrobials in poultry production?
Okay, thank you, Dr. Zainab. One first approach you can use, instead of antibiotics, vaccination does go, it goes a long way. Like, there's something called prevention is better than cure. There's a reason why they said that, and it has been working for a very long time. Before they get sick, do the prevention, so you don't have to give the antibiotics. And luckily, we don't yet have a anti-vaccination microbial resistance something. We don't yet have a vaccine that is like a bacteria that is resistant to vaccine. Thank God for that. We don't have that. So vaccination should be your first approach to things. Second thing is probiotics. Probiotics are organisms that you can inculcate or put into animals to encourage good gut health. So this way,
Growth promoters.
you are introducing these bacteria, these organisms into the animals, and the immune system is ready for it. It's almost the same system by which vaccination works, but it's just a different pathway. Do you get? So probiotics go a very long way, and you should have an habit, like a management system that, okay, regularly I'll be giving probiotics. That would help with that. Which other method? I think those two major things are very, very important. Vaccination, probiotics. That's it for now.
All right. So thank you so much. You want to? Okay, go on.
Thank you very much. What I want to add is that for probiotics, right, the important thing is in the gut of these animals, or even in humans too, there's something called the good bacteria and the bad ones. So what this probiotics tries to do is to enhance the growth of these good bacteria, you get, so that they are able to, in a sense, overpower the bad ones.
The bad ones.
Yes. Even though it's not like they can completely eradicate it, but when good people are present, the bad people go hide.
Yeah.
Darkness, light and
Yes,
darkness
and
does
light
not
and
mix, that kind
darkness.
of thing. So once the good bacteria are plenty, you get they sort of reduce the activity of the bad ones. And
Yes.
then as an addition, I would like to think that other than probiotics and vaccination, even adequate nutrition, reduced stress. These are some
Exactly.
adequate nutrition. When I mean adequate nutrition, I mean even if it's in the poultry or livestock or even in abattoirs,
Yes.
if you feed this, you notice that they say food is medicine, right?
Yes.
So proper nutrition, proper feeding, where these animals are well taken care of. They could. I would like to think that aside maybe adverse environmental effects, not necessarily come down with any disease
With
as
any
often.
disease, exactly.
Yes, that would lead to you giving them antibiotics back
the
to back and
rest.
then lead to infection. So nutrition, reduced stress. Take these animals. If you are humans, I would say exercising and all that. For animals too, you could do that. Take them out, allow them to just be animals and all that. Yes. So I like to think these are also alternatives that could be added to what she has mentioned.
All right.
Thank
Thank
you.
you so much. So one last question for Dr. Toby. What will be your advice to abattoir workers and veterinarians working in the abattoir to ensure that antimicrobial resistance is eradicated?
All right. Thank you once again. To my fellow abattoir workers, I would advise us all to follow stringent sanitation and hygienic protocols, biosecurity measures, and also we should always be on our PPEs. And then for the veterinarians and meat inspection officers, let's try to, and also for the government too, let's try to, and that's true. Let's try to carry out antibiotic residue tests because we're not just looking at these microbes themselves. If these residues are in the meat and it's consumed by someone someone that hasn't been exposed to that antibiotics, when that person comes down with an illness where that antibiotic is supposed to work or that antimicrobe is supposed to work, it won't work.
Yes.
We cannot blame it on disease. But from even then for the animal owners, if once your animals or you notice that your animal is sick, don't just use something because it worked yesterday. Or don't just use something because Mama Chidi said it works for her own. Call your veterinarian, not animal scientist, your veterinarian, your doctor. Call your doctor, please, and then tell them to come and see what is going on, and they would help you out. And then for the third people, sorry.
Okay, I'm a
The-
government.
Okay, I'll address the government.
Okay.
For the government, for the animal owners, for the veterinarians, please
And the
let's
abattoir
let's-
workers.
and abattoir workers, true. Let's not just use antibiotics anyhow. Let's always have a reason and be sure that what we're treating really needs that particular antibiotic or that antimicrobial as at that time. Thank you very much.
Thank you so much, Dr. Toby. So back to you, Dr. Victor.
All right.
So what will be your advice to livestock owners?
Well, my advice is not so far from what they've said. Well, everybody knows adequate sanitation is important. If you have to keep a livestock, then have a facility that would contain this animal, the number of animals you want to keep, right? Don't jam pack the animals. Let's bring it down to that. Don't put them down together in a confined area, because all of these stressors could even be what making them come down with these illnesses. Understand? And even in transport, certain measures, because most of the times where you rear is never where you go to kill. Do you understand? Where you rear is not where you go to slaughter, rather, sorry. Where you rear is not where you go to slaughter. You could have a farm, and then for you to slaughter, it might be having your farm in the village, and you have to bring it to the town for slaughter. You get? So during transport, the animals are stressed, and there are certain factors they're exposed to, even the car you're bringing to come and carry them and all that. These are certain little measures you could put in place such that you tend or you try to reduce. I know it is almost impossible for somebody who is not learned to attempt to do these things. But it's important that once in a while you try to, not once in a while, as often as possible, you try to follow these measures. Sanitation, very key, a very key factor. And then management practices. What do you feed these animals? When we talk about nutrition, what are they being fed on? How can they be exposed to these illnesses? All they call it in contact. Too much contact leads to some of these things. So if there's any way you could reduce them from having contact with each other, yeah, just like I mentioned, isolation of the ones that are sick from the healthy ones, so they don't infect them. And then observation of withdrawal period. That is something very important. But I know that for us Nigerians, we are too impatient. We want to make money. We want to move your cat to sharp so that they slow down, you sell, make money. But it's important that if you use any antibiotic on a cat, there are certain number, I think about 3 weeks, I'm not 2 to 3 weeks, that you're supposed to refrain from taking them to the market so that these antibiotics leave their body before you sell them. So these are measures that you could, try to adopt so that you reduce the amount of this that goes into the market. From your own, it is very good to do an honest job, When you do this, even your conscience, is clean. You know that, yes, I have done the right thing. Even if it starts with you, that's basically what I'm trying to say. It starts with you. Do your part, vaccinate when you're supposed to vaccinate, clean when you're supposed to clean, twice daily, 3 times daily, depending on your facility. Do not jam pack these animals. And then for transport to reduce stressors, you understand? Even the whole, not feeding after, and then even the exposure to their own carcass, because they all stay together, right? One might have infection, the other will come and sniff it. Collected. So all of these things are just small measures that you could put in place and try to reduce or curb the spread of these infections first, and then the anti-microbial resistance that comes with it.
All right. Thank you so much, Dr. Victor. So on our last note, Dr. Deborah, what advice would you give to poultry owners?
Okay. I would like to say something in terms of the government being involved. Actually, I think this can be crossed to the abattoir members. Some of these farmers, the reason why they do these things is not because they don't know. They know. It's just money, economy. And because of that, they clear off their conscience and they don't do the needful. There are programs that are involved where government is supposed to reach across to some of these abattoir people, farmers, whenever, there is a problem with the meat that should be dispersed to the public. And I think this is also involved in the poultry farm too as well. When outbreaks occur, the government has to come into place to help with things like this. So that's just on one side. Advice to poultry farmers: call your veterinarian. I'm not going to emphasize that too much. I think we need to talk about it way more. In Nigeria, it's a big issue. It's a big issue. I don't understand how. Animals are complex. We hardly understand ourselves. Not to talk of animals. For you to think that you can treat animals on your own, so veterinarians are very, very important. Your treatment regimen, have onboard veterinarians on your farm, and do that very well. Then public health procedures, management, sanitation. Your environment should be clean. Don't let bush vegetation to be anyhow. Different things, like said, multivitamins could really work in helping their immune system. Then there's one practice that farmers do carry out, poultry farmers, which is not good. Fattening up poultries like chickens and their hen with antibiotics. I don't understand why they do this, but it's a practice in some places, and this should not be done. We actually understand that the demand for chicken is high, because there are even some religion that may not like cattle, or there's health implication of meat, red meat. So people might take chicken more, but doesn't mean that you have to now do cause problems for the people that are going to eat the chicken. So poultry farmers should avoid using antibiotics as fatteners. I think that's it from my end.
All right. Thank you, Dr. Deborah, Dr. Victor, and Dr. Toby for shedding more light on anti, because actually it has been a threat to not even animals alone, but also humans, because it can lead to risks of increasing the risk of disease and zoonotic disease and also death. So please, let's try as much as possible to reduce the use of this antimicrobiotics. So thank you all for listening as we have come to the end of this program. Don't forget to follow us on all our social media and stay tuned for more interesting topics. So join us on our next Experts Mind episode. Thank you. I remain Dr. Zainab Abdullahi Biu. Bye.